Hello, I'm Dr. Kim Hawkins, and this is Dr. Lindsay Iverson, and we are two of the developers of the CCEI. You have just listened to Dr. Julie Manns speak about the background of the instrument itself, and now we will talk more about what you will do before you begin evaluating students. We have provided you with the two worksheets, a blank CCEI discussion worksheet and an example CCEI discussion worksheet. And the purpose of these worksheets are really just to facilitate conversation among faculty evaluators and provide a template to establish minimum expected behaviors for each item on the CCEI.
Faculty will then determine what the key behaviors are in order for a student or a group of students to receive a score of 1, which is demonstrate competency. For each item on the CCEI, this allows for a consistent assessment of student performance between evaluators.
Okay, and basically what we want to do now is really just have a conversation about some of the common questions and concerns that have come up for people using the instrument and that we've come across during development of the instrument.
So Kim, the first question I have when I'm looking at this instrument is, say I'm the only evaluator that's going to be evaluating the student or a group of students. Do I still need to in advance go through this instrument and select the behaviors I want?
Yes, and that, that can happen. Oftentimes we are the only person who's doing the evaluating, but even if it's just you still want to go through each of the items and decide in advance which behaviors are going to be the required behaviors for those items. That will just allow you to be consistent as you evaluate each of your students.
Okay, that makes sense. So if we can just go through each of these sections,
Sure.
I just had a couple questions that I just wanted to go through. So the assessment actually looks straightforward. So I look at the 3 items under assessment: obtains pertinent data, performs follow-up assessments as needed, and assesses the environment in an orderly manner. And then I decide what behaviors I want for each of those items in order for a student to demonstrate competency. Does that sound right in summary?
Yep, that's exactly right. So for example, when you look at performs follow-up assessments as needed, say for example, if we were doing a scenario with our students and they had to give an albuterol treatment, we might sit down and decide, well, after the albuterol treatment, I have to see them do a respiratory assessment, and that's a minimum required behavior for them to get a 1 for that item. So, and we would make that decision together and be consistent in our grading.
Okay, so expect my students as a critical behavior that they then ask the patient if they had an improved response to that albuterol treatment. And I would require that of the students for that certain item.
Yeah, I agree. So if we agreed that those were 2 things we wanted to see a respiratory assessment and we wanted a subjective assessment of the patient, then those would be the 2 behaviors. So we might have 2 or even 3 behaviors that we decide upon that are critical for that particular item.
Okay, great. So let's go to the next section under communication. It says documents clearly, concisely, and accurately. I'm trying to think of some of the simulations that we've done with some students, and not all of the time do they do documentation before, during, or after the simulation. So do we just give that a not applicable?
Yes, that's exactly right. So oftentimes there's going to be several items that may not apply to a certain simulation, and so in advance you decide those, you make them not applicable, and then they just don't count towards the total score of the instrument when you're grading them.
Thank you for clarifying that. So let's just go under that clinical judgment area under interprets lab results. In some of the simulations, students don't always get their lab results during the simulation. It may happen afterwards. So should they still get a point for that, or do we give them a point during discussion, or how does that work?
Yeah, and this is really one of those items where the students don't often articulate, their interpretation of things. So that's a really good point, and a lot of times that'll come out in debriefing. So debriefing is still part of the simulation, and so if you see that in debriefing, you can definitely count and give them credit for that particular item.
So I guess still under that clinical judgment that evaluates evidence-based intervention and outcomes, how do students verbalize that? Do you have any recommendations? Because in a lot of our simulations, I don't see or require students to verbalize that.
Yeah, and that's another one of those things where they're not always articulating it. And one thing we've done for that is we actually have a whiteboard in the simulation room, and the students at the beginning of the scenario will have them write some of their expected outcomes, maybe 2 or 3 outcomes, right on the board, so we can see it when we're watching them do the simulation, and it lets us kind of really see them think out loud, and it lets them also think about what am I expecting to see from this particular patient class.
Yeah, I really like that whiteboard idea. I think that's something we can definitely use for that, that item there. So let's go under patient safety. There's something on there. Let me see. Performs procedures correctly. Let me think of an example. One of the students was doing a simulation where they had to insert a Foley catheter.
Okay.
And they were doing a great job during the simulation, and they got to insert the Foley catheter, and was following everything correctly. And then they broke sterile technique just once, but they did everything else beautifully and step by step. Do they not get the point because they broke that sterile technique, or what do we do?
That can be a really challenging item on the tool, and that kind of has showed up in our research when we were developing the tool as well, as you know. And so it's really, again, that group discussion amongst evaluators ahead of time. So maybe you and I will sit down and say, you know, they have 3 procedures in this simulation, and even if they do everything right, if they break sterile technique, that's a deal breaker, and so they're not going to get the point. But we might decide that if they catch where they broke sterile technique and they correct it, then they would get the point because they recognized it. But it'll depend a little bit on the level of the student and what they're doing, but it's again that conversation and deciding ahead of time so that you're consistent with all the students.
Well, I think that's all the questions that I really had regarding the CCEI, so thank you for going through all that with me.
All right, well, thank you as well, Lindsay. Now, of course, you will need to go through each individual item and decide what behavior you would like to see for your simulation in order to earn a score of 1 for that item. And remember, select the minimum behaviors you expect to demonstrate competency for each item. There may be many other behaviors you would like to see, and that can be part of the debriefing discussion. But what are the key elements that must be done in order to achieve competency?
And finally, we want to thank all of you for watching this orientation discussion today. If you use the procedure outlined here to determine expected minimum behaviors to achieve competency, then you will hopefully be able to achieve consistent assessment of student performance during a simulated clinical experience. We wish you the best of luck as you move forward in utilizing the CCEI.